At Wave Plastic Surgery, because we are so specialized in periorbital aesthetics, we think of the lower eyelid as the gateway to the midface. And the junction of the lower eyelid and the cheek is an especially crucial area where patients can develop tear troughs or eye bags with aging. And so handling that in a way to treat those aesthetic deformities, but also leave patients with a natural appearing result is of paramount importance. You want to see a surgeon who understands the continuity between the periorbital area and the aesthetics of the rest of the face and treats those aesthetic units in combination. We remove fat from the lower eyelid from the inside, so that incision is hidden as we invert the lower eyelid or flip it over. And the removal of the fat portion is performed in that way that allows us to plane things as precisely as possible. Typically, we also perform a procedure called a lateral canthopexy that allows us to tension the lower eyelid and return some of the natural support that people lose of the lower eyelid as they age. This also allows us in the last phase of the surgery to reduce the amount of skin that we resect. Following lower eyelid surgery, sutures are generally removed after a week after the surgery. We encourage patients to stick to light activity for the first 2 weeks after the surgery. They can expect to return to the gym 3 to 4 weeks after the surgery. And of particular interest is that we ask patients to refrain from putting eyeshadow on for the first 2 weeks after the surgery. Makeup and foundation they can start applying to the cheek and lower eyelid after about a month. Contact lenses should not be replaced in the eyes for about 2 weeks after the surgery. So those are some helpful guideposts for patients for their post-operative recovery period.